Hi there, Dr. Wayne McLeod with another video discussing the disability tax credit. Today's video will be a relatively quick one. I want to discuss the section of the disability tax credit application that's called life-sustaining therapy. So the disability tax credit can be applied for by persons who have a condition that requires a significant time element to managing their condition. So for instance, people who have renal failure who have to attend the hospital for hemodialysis, or thinking about patients who have cystic fibrosis who have to go for chest physiotherapy. Another example would be a condition that's treated by hyperbaric oxygen therapy, which is therapy that requires attending for a couple of hours at a time, a few hours a week. Patients who have insulin-dependent diabetes and who have to spend a considerable amount of time titrating their insulin dosages according to their blood sugars, or if a parent has a child who is insulin dependent and they have to measure their child's blood sugars and titrate their insulin carefully according to their blood sugars. That requires a significant amount of time, and the tax credit allows for conditions that have a time element to the management of the condition. The rules are that the condition has to require 14 hours a week and a minimum of 3 days a week in order to qualify, and it's best if the person helping the applicant specifically describes exactly what is required in that time element in order to manage the condition. It's not likely that many of these are being missed by people who should be applying for this credit, but in the event they are, that's the explanation. Again, I'll put my contact information down below, and if you have any questions or challenges around the disability tax credit, please don't hesitate to ask. Take care and have a great weekend.